Right, good evening everyone, and thank you for joining us in this Fishbowl, a little bit like the theatre in the round. My name is Martin McKee. I've been coming to Gastein for 28 years, and it's great to be back again and great to see so many of you here this evening because we know that you've all had a long day. We are going to be talking about public health diplomacy. And you're going to say, what on earth is public health diplomacy? Why do we need another word? Don't we have enough words for the things that we do when we want to change people's minds? Let me go back to the very beginning, because the first ambassadors were sent by the Italian medieval city-states from one city to another. And their job was to look around the streets to see the signs of plague. And as soon as they saw people dropping dead from plague, they got on a fast horse and rode to their hometown to say, pull up the gates. That was the original role of an ambassador. Now, diplomacy is a challenging thing to talk about in public because it's not done in public. And that is a key issue. In public health, we are very much used to advocacy, where we have a message and we're broadcasting it to the world, where we have the same message for everybody. The problem with having that same message for everybody is that for some people it backfires, it has the opposite effect. And for some people, they just switch off because they know we're from public health. So we have to do things differently. And here I draw for my inspiration on an Englishman, I'm Irish, but an Englishman, Sir Henry Wotton, who was a British diplomat who was in Augsburg in Germany in 1604 and said that an ambassador is an honest gentleman sent abroad to lie for the good of his country. So diplomacy is about saying different things to different people, in my view. Now, we've tried to help a little bit because if we could have the first slide, I was asked to pull together some notes on this, and we wrote a paper because that's what you do in public health. And if we go to the next slide, we set up a series of principles, lessons, and so on, which I'm not going to go through in any detail because they're up there. But public health needs to be a diplomatic priority. What are governments for if it's not for promoting the health and well-being of their population? Why do we pay them taxes? Why do we bother electing them? What is the use of them? And then we need to strengthen multilateralism at a time that it is under unprecedented attack from both sides, from Russia, from the United States, and from some parts of Europe as well. We need to listen to people. We need to be the voice of the people. We need to go back to Virchow and others who said that we should be the attorney of the poor. We need to represent those voices, make the invisible visible. We need to practice, because we're not very good at doing this. And part of the problem is that I'm not going to tell you about the things that I've done that I think are health diplomacy, because if I told you about them, it would undermine them. The whole point of them is that you do them behind closed doors. Some of you know some of them, but I'm not going to talk about them here. We need to look at the training. We'll talk more about that. And we need to go through all those other things, so I won't bother you with that. So what I now want to do is to introduce one of the thought leaders in this area, Ashish Joshi, who is the Dean of the School of Public Health at the University of Memphis in Tennessee in the United States of America. And just for the simple fact that he had the courage to cross the American border, I think a round of applause for that alone. He may never come back again, but he's here. Ashish, over to you.
Thank you so much. I don't know whether I'll come back or not. I just want to make sure that I go back. Let's put it that way.
Just don't like any tweet from Martin.
Okay.
I'm not on Twitter anymore. I've left. So should you, Boris.
So thank you so much. First of all, obviously, this is my first one. I'm here for the first time at the European Health Forum Gastein. So I'm very humbled and privileged to be among you all. That's one. On the second note, I want to thank the organizers for giving us this platform to come here and just share our passion and commitment to improving the health and well-being of all the populations. That's all. And before I go into my slide, and at the same point, I also want to acknowledge ASFR and ASPPH that has been so kind enough to support this initiative. And of course, this has not been possible without the support of our esteemed colleagues, great collaborators, partners, and above all, you all who have taken the time to be here. So instead of just going through the PowerPoint slides, I take a case study approach, if that's okay with you. And the whole idea is, I come from Memphis, which is a very deep blue city in a very deep red state of Tennessee. And as a dean for the School of Public Health, one of the most important things was how do you really navigate the systems? And I may say here is that one of the biggest challenge, and this is just my view of the last 15 years, not 25, 30 years, but 15 years of working across multiple countries in multiple settings, has been that the people have been left in isolation. And things have been evolving so rapidly that at some point we have forgotten the people for who we are actually doing the things. So that's the kind of a context. So public health diplomacy is coming from a very lived experience in an era of uncertainty, complexity, and unpredictability. So if you may allow me, I'll just, obviously, many of you are in some capacity working in the area of whether it's so-called diplomacy, whether it's health, science, digital, linguistics, travel. There are so many diplomacies. But to just give you some context to what global health diplomacy was, is really to improve health and improve relations amongst nations. That was a very common terminology. If you look at the global health diplomacy was largely done by people who had credentialed or who are diplomats. They are not coming from the health background. They are not coming from necessarily the experience of why health could be a critical component. And I think it was a very top-down approach, which means, yes, it engages civic society, it engages NGOs, it engages private partners, stakeholders, but people who are at the grassroots level sometimes have been left out. And that's where the global health diplomacy has been. If you look at the bottom of the pyramid, there's an informal diplomacy that happens. It's people to people. It's industries, it's organizations, it's engagement at different level. So this global health diplomacy, if you look at it, there are very few people at the top level who are practitioners, but there are a huge number of actors and sectors that are engaged at the bottom of the pyramid. So why there's a need for public health diplomacy? As schools of public health, I just want to first of all differentiate how public health diplomacy and what the need for public health diplomacy is from the global health. During COVID, the biggest challenge for public health practitioners or policymakers was how to communicate to the politicians. That was a big challenge. And they have never come across that level of crisis, how to respond to those crises. And I think the first gaps became evident during that period of time. So if you look at it, there's a growing number of countries that are now engaged in health policy. Traditional diplomatic channels are one way of communication. I'm not going to go through the slide, but I'll just speak from here that the very important aspect was the local context. A lot of global work is being driven by local context right now. So we have for too long actually almost like deviated from the local context and focusing more on the very top-down level of there. And our hope was, can we train the public health professionals in an area that they can respond to the crisis and also use as an opportunity to navigate for improving the health and well-being of all the populations. So with that kind of a perspective, I just want to acknowledge our university leadership, and I approached them that we would like to establish public health diplomacy lab. The first question was, what is public health diplomacy? Why it is needed? And the three things that were very classically different was, one, it will start at a local to global level, and I call this as a glocal model. I don't use the word global, I don't use the word local. It's a glocalization. That means there are needs of the people at the grassroots level that will allow to influence the policymakers and the politics of the public health itself. It's a middle-out approach. Where do we align the policy priorities to the community sides? To establish the lab, of course, this is not an individual effort. This is an effort where I would like to say the Global Network of Academic Public Health, ASPPH, ASFR, we all came together. And this was largely to bring all schools of public health together. So the first summit was done September of 2024, 15 countries, 29 experts coming to the Memphis. and really talking through about what does public health diplomacy mean, actually. And I'm sure that we all know that this is a world of fragmentation, as much as we can say, but it's also an opportunity to build consensus, to build some negotiations, to build understanding about how do we really improve and take this to improving the health and well-being of the people at the local level. I really want to emphasize that public health diplomacy is really being driven at the local to a global stage. We had 15 countries coming together, and one of the key elements of that was that unanimously, after 100% consensus, my dear colleague Ramana was there, and we were able to, over a 3-day period, define public health diplomacy. So the fact that the consensus definition could have been built together, representing different geographic settings, different regional settings, I think was at least a first step forward to this reimagining public health through the lens of public health diplomacy. I just want to highlight some of the key words there. Was one, that how do we train the public health students, the professionals, and the practitioners to negotiate, facilitate, and build consensus? Consensus, as my dear colleague mentioned, is not always going to be done on the front end, it's also on the back end. So yes, we all want to do good things, but we also have to understand how to negotiate and do consensus building around that. Systems thinking was a key element of that. How do we really train the public health professionals and practitioners to think from the lens of where multilateral relationships come in? Human-centered values are a very important element, because human-centered means who are the users who need to be engaged in? Who are we doing this for? What is the purpose of that we are taking this? So I think it was an approach to really look at how and best we can train our public health workforce in that area. There were 9-point action plan. We never wanted to just have a definition and then leave the summit and then say, okay, thank you very much, we're done. No, there was a 9-point action plan that was defined, that how do we really establish a global public health diplomacy working group. I'm not going to go, but I'll just say very important part was, how do we bring regional experiences, best practices, and achievements? So in that case, this was one of the kind of an example of the action plan that has led us to be out over here. So I know that I don't want to go through the whole things, but just in essence, I would say that this is an effort which is a middle-out approach, connecting the top to the bottom of the pyramid, from the local to the global, and coming from the schools of public health. That's where I would like to.
Great. Thank you very much indeed. Thank you. So, once upon a time at this forum, I found myself on every session, every timetable slot. That's no longer the case. However, my role has been taken over by Natasha, who needs absolutely no introduction because, as you know, she represents a constellation of public health, not just one star, but by appearing everywhere, an entire constellation. And Natasha, you're going to tell us, I don't think you need any introduction, but so I'm not even going to bother. You are going to help us to think through some of these issues as they apply to policy and practice. And we know that you're really busy, so thank you so much for coming.
Thank you, Martin. And I think I learned a lot from you. And one of the things that I've learned from you is your incapability to say no to anyone who approaches you for anything. And normally what happens is that, yes, I end up then being in the stage where I'm a bit overbooked. But I've made it in time. So I made it in time. And why am I late? Because I'm doing shuttle diplomacy. That's what I'm doing at the moment. And some of you who have been talking to me over the past days know that basically we are in a very difficult place at the moment. That the global order on health does not even exist any longer. Where we are going back, and language that was agreed in the 1990s, in the early 2000s, if you just chronicle the text, it's becoming diluted. It's backsliding. And what we are seeing is that actually some of the countries who have been at the forefront are struggling. They're doing their best, but they are struggling to hold the line. And this is where the European region is important, and we need to keep speaking and doing things. But honestly, if I look back, and Lord, I've had training, and I've been privileged to have had some of the best training. But has anything really prepared us for what is needed at this moment in time, in terms of the persuasion skills, of the diplomacy skills, in terms of really being able to go back and forth, in terms of trying to use a different toolbox to the toolbox we know? The toolbox we know is no longer fit for purpose. It's not going to get us where we need to be. So I think that I can speak for myself, very honestly. I don't like this fishbowl thing, by the way. I always feel I'm giving someone my back, but there's no other way around it, it seems. We are learning by doing. But we need to be able to talk, to be far more tight. We are not tight enough, Martin. This is what I feel. I feel that we don't have the channels and we are not tight enough. This morning we were sat in the same room and we were talking about information, surveillance, and somebody from Ukraine said, maybe we need to learn from defense and from the army. And probably we have a bit of this, if you want to collaborate with WHO, one of the first forms that you need to sign is that you have absolutely nothing to do and no relations, and I see Monica smiling there, with anything to do with the arms and defense industry. But maybe we need even to start talking and learning from actors and constituencies who we would have never been bedfellows with. I'm sorry, I'm not sure how long you wanted me to speak for. I'll stop here.
That's great. Thank you so much. Thank you. So, our third speaker in this panel, in this fishbowl, is Ramunya Khaledian. Again, we've known each other for many years, it seems like since we were children, but it's quite a few years. And Ramunya is going to be talking about how we create a workforce who have the skills that Natasha is pointing out that we really need, speaking on behalf of the Association of Schools of Public Health in the European region.
Okay, I think I better stand to see most of you. So as Martin mentioned, I'm representing, in fact, not only Lithuanian University of Health Sciences, so particular School of Public Health there, but also ASFER and AFIE, Accreditation Agency for Public Health Education. So I'm sure that in the current situation, essential thing is to not only develop technical expertise for health leaders, but also to equip them with health diplomacy, public health diplomacy skills. And here I think we have to develop completely new curricula, even think about separate discipline or professional track of public health diplomacy. And here, associations of schools of public health and accreditation agencies for public health education should play an essential role. And if you look at the screens where we have developed actions for public health diplomacy, and if you could just, while I'm talking, quickly look for it, you would see how big role is devoted here for schools of public health. And the major challenges I see working at the local level is I have some worry to be too local. You know, I would avoid separate developments in particular countries, in particular schools. Here we need global network. We need network of living laboratories for public health diplomacy. And my dear friend Ashish is, I think, the father of the first one, and we are working now on very wide scale to develop on those public health diplomacy living labs, as well developing research activities across the globe devoted to this important area. Another challenge I see is lack of support of the local schools, and especially when I think about medical education and medical doctors, those who are medical professionals, you clearly know how overbooked is a curricula of medical doctors. So I'm afraid that it will be difficult to implement new public health diplomacy skills in their curricula. And also, I think we are still lacking professionals who could teach in the schools public health diplomacy. So training for trainers, local support, political support, these are the major challenges. But I see that Martin is eager to take my mic off.
To ask you questions.
Yes. Yeah, so I just have one final sentence. I think that now it's essential to develop this global network for public health diplomacy, both training, research, and practice. Thank you.
Okay, thank you very much indeed, Ramunia. And there is thank you. There is clearly an agenda. I want to just ask the three of you, do you think that we in the public health community actually are up to this? And I'm thinking of a conversation I had last night with somebody in this room, and they can identify themselves if they want, but I won't, where we were talking about developments in Belarus. And if you've been reading the newspapers, you will know that Lukashenko is trying to open up to the West. He had US military observers at the recent exercise there. He's been releasing political prisoners. Are we fully, I mean, that's one of your neighboring countries. It's next door to you. Then when we did the Pan-European Commission, this is out in the open, Josep and Natasha and myself and others, debating issues like the ongoing debate about environmental, social and governance indicators in the global financial markets. Article 4 investigations by the international financial institutes, where we were having to have conversations with former heads of government about cybersecurity with a former Estonian president and a former Russian deputy prime minister, or where we were talking to former central bank governors and other European commissioners. Are we able to do this? Are we fully up to speed with what's going on? Do we read the right newspapers? What do you think? Who would like to say? Natasha.
I mean, I already said, and I say this, I don't know, it's probably not what you expect to hear, but I say this with utmost honesty, that I think we are out of our depth for what is required at this moment in time. But I'm also convinced that if we put our heads together in a very smart way and we leverage the immense power and potential that there is out there, then we can make it happen. But we need to be able to let go of some of our prejudices. And I think this is one of the common themes that has come through. How do we get this balance right? How do we let go some of our prejudices as a public health community? Because if we're not going to be talking to a far broader constituency than we have spoken to in the past, I mean, we heard it. We heard it somewhere in Gastein yesterday, Chatham House rules, that we are almost becoming a side node, a marginalized community. And if we want health and well-being to really come back to the fore, I mean, my assessment, and please feel free to challenge me, right? But my assessment increasingly is that since the COVID pandemic, as public health, we have lost the hearts and minds of the people we stand to protect. Somehow, somewhere, we've lost our way, and we are talking about one risk factor at a time, one virus at a time, and this is overwhelming people who want to live and enjoy living. And we need to get the balance between physical health and mental health right, too. And there is a balance to be made over here. So probably we need to go back a step. And there were people who talked about, you know, the salutogenesis theories and all of that.
Yeah,
and it's like we need to come back and think, what do people really need to live a healthy life?
So in this new world, Ashish, I'm going to ask you, I quoted at the lunch the other day, Clausewitz, war is the continuation of politics by other means. Are we up for the fight? Are the people that you're training willing, courageous enough, willing to actually take the risk? And I really pay tribute to those of you in the United States at the minute where people are being kidnapped off the streets, being sent into who knows where, and where very powerful institutions are, frankly, are being hammered. So, you know, this is a real challenge. Are we up to it?
Thank you so much. I'll just be very brief, but I'll give you an example of very quick on that is, the reason that all this has been also happening is because it's not about we are ready for the fight or not. I think we are actually dealing with a lack of informed youth. We have not been able to get our message across to the people who the message should go to. It's a messaging problem. And when you have not a proper message, you're creating a vacuum. And when you're creating a vacuum, you're letting a lot of kind of noise getting into that. So I'll quickly give an example of this is, our focus has been to really take public health diplomacy at the high school level. That's what we are talking here about. A high school level child who is engaged with the family, with the community where they're living. And I can tell you that at least in our case, as I mentioned earlier, that we have right now about 16 public health schools, high school students, who are now getting understanding about, they don't care about what science is publishing in the research, they are being channeled in a way that is being communicated. So I think that's what we need to look at it. How best we create an opportunity for them to get the right information to the right place at the right time to make a much better informed decision.
Great, thank you very much. We have, I think, about 1 more minute, 1 or maybe 2. Ramon, so
Yeah,
final thoughts.
I just want to continue that public health diplomacy skills and competencies, I think they are needed for us all to learn, not to try to break the wall with our head, but to clever understand how to manage it. So I would avoid this, you know, straightforward fighting. So.
Okay, thank you very much indeed to our 3 panelists. And now I will hand over to Josep, who has the major challenge of getting us to finish at exactly 7:30, so you can all get to dinner. Thank you very much. Thank you.
Yes, that's the diplomatically, my friend Martin said, either you finish at 7:30 or I leave the room. So there you are, I got the message. I'm Joseph Figueras, I am Director Emeritus of the European Observatory, and actually I'm an ambassador, Martin. I'm an ambassador of the Health Union Fellowships. Got a big title, actually, but I enjoy it. You all know at the European Health Union Fellowships, and then we are talking about ambassadors making change and diplomacy. This new generation of very senior people, by the way, that have joined this program will be those ambassadors, those diplomats, to put forward our European Health Union. So, we heard, are we up to it? We are irrelevant. We need to fight. There's a war. I don't want to hear that anymore, okay? That's finished. No more fights, no more wars. We're not irrelevant, or we're irrelevant, I don't care. I care. Let's not talk about that. Let's be practical. Let's see, and I'd like to have back in a minute sort of the list of very humble things. Very humble, but very useful and effective things we can do Monday morning. Okay? Let's see how we come out of this one with practical things that we can do together. What I like to hear, and we have plenty of time, and I promise, Martin, I will not waste it by talking too much. We have a full hour of a fishbowl, okay? And we want to have you here to say which one of these things you like to do, or which another 10 things you like to do, and how you're going to bring your own organizations, your own ideas to do this fight. But let's not talk about, because it's been very important, it's been said, that we're irrelevant. We are indeed irrelevant. We heard it, we see it, we experienced after the COVID. Fine. Now, let's move out of here. I'm not going to rally you to a war, and, you know, these are, you know, humble weapons. But they're weapons. They're mechanisms. They're ways to exercise this diplomacy. And you'll realize when we put that there first, and I think something very important from Ashish, who's our leader here, is that the first one is coordinate and exchange public health with other public health diplomacy networks. We are not here to say we are the public health diplomacy. No, no. We are here, the schools of public health in Europe, the schools of public health in the United States, coming together and saying, what can we do as diplomats ourselves, or even better, right, Ashish, to support those diplomats? What kinds of things we can do Monday morning to help them? That's the lens I like us to work on in this remaining hour I have with me. And to start, 3 places occupied, I'm sorry, in the fishbowl, but that's going to be the hot seat, and I want this hot seat to be occupied by many people with short and sharp and clear contributions. But before that, we'll have 3 occupied seats, which are Ayman El-Mohandes, Dean of the CUNY Graduate School of Public Health in New York and Health Policy, who's been very much behind this public health diplomacy strategy. Ayman? You can avoid that one. Otherwise, I'll push you out very quickly. Yes, yes, yes. Thank you. Charlotte Marchandise, Executive Director, European Public Health Association, and Claudia Havel, Austrian Public Health Institute, GOC. So, I see already sharks here ready to go into the fishbowl. I see octopus with several legs. I see medusas. I see all sorts of individuals here, so I want you all here to have that kind of debate. I don't want a nice debate. I want a sharp, clear debate, critical debate about how we go about with public health diplomacy. Can I get back the slide with the 10 suggestions? Thank you very much. So let's just start with Ayman. Ayman, yesterday we tried our best, our first go at this, and we got quite a good debate, right? I mean, it was really interesting about who are we. And as Martin is always saying the right things in the right times, you know, isn't that public health? Are we supposed to do that for a living? Why are we talking about that? Well, because we haven't done it. So perhaps this public health diplomacy entry point could be a good way to do what we're supposed to do for a living, right? Ayman, what did you hear yesterday? Take the microphone.
It was a very interesting conversation, but first and foremost, I want to apologize for my appearance. I was told, this is my first time in Gastein, many of you have been here for decades, that this is going to be a colorful soiree. So I looked in my wardrobe, my brown suit didn't cut it. So that's what you're getting tonight, okay? All right.
Bravo. What fish would that be? What fish would that be, that color?
Okay. But yesterday's conversation was vibrant. There were many points of view, not the least of which was, who do we engage in public health diplomacy? And that was a very important point, because public health, and I will say as somebody who is the chair of the Association of Schools of Public Health, I'm fully aware of a certain demagoguery, if I may say so, in public health itself, where we have alienated certain groups. We will not talk to pharmaceuticals. I remember very specifically a day at the American Public Health Association.
Have you heard that?
Yeah.
It has never stopped me from talking.
No. I will tell you a story. I will tell you a story. At the American Public Health Association meetings, one time, one of the pharmaceutical industries sponsored the booklet that was distributed by the association. And all the members of the association, one by one, went to the stage and threw the booklet on the stage. Now, if that is not undiplomatic, I don't know what diplomacy is. We have in public health become so fixated on certain terminologies, such as evidence-based. Whose evidence is it? And if we only use empirical, I'm an immunologist by training and I'm a physician, so I know what I'm talking about when I'm talking about empirical sciences. But we have chosen to ignore other sciences, social sciences, political sciences, and other sciences that can contribute to our efficacy. We may not in large organizations or very enlightened people, but we have enclosed fora. Number one. Number two, the question came up as to who to engage. And so I think many suggested the broadest forum. We need to engage, if we're going to find allies, and we need them badly, we need to engage everybody, starting from communities to politicians, to policymakers, to economists, to bankers, to, God forbid, pharmaceutical industries, to healthcare providers. We need engagement in diplomacy in the broadest perspective. The other question, and Martin is a philosopher and in his own inimitable way, described why what we are suggesting is not necessarily advocacy, but is not against advocacy. It seems like diplomacy and advocacy are two wings of the same bird. And we need that balance. We need advocates. We need people who are staunchly behind a certain point of view and will publicly demand attention to that point of view. We need those badly. And I have advocated for women and children all my life. So I understand the importance of that. But at the same time, there needs to be behind-the-scenes activities that are not heard nor seen, that are as influential as what is in the public arena. That was discussed yesterday as well.
Perfect.
These 2 points alone require a lot of investment by all of us to think, how do we create that balance? And within the public health profession, how is it that we become friends, the diplomats and the advocates? So you're not less because your voice is quiet or because you go in camera and talk to people who don't want to talk to each other. You're not less than an advocate that goes out with a spear and tries to make change at all levels. And that is something that we, as public health professionals, academics, policymakers, need to contemplate. There is no place for me and you to be anything but friends.
Perfect. So you see where the Ayman comes from. I like that very much. I want very short introductions now from both of you now, because then you'll be my resource people to respond to some of the points we have on the table. Charlotte, you're actually an advocate. If there's an advocate, you come from that world, you have great successes on your backpack already. How do you see that? How do you see this diplomacy, advocacy?
So for a personal story, so I've always been an advocate, especially from community perspective, and this led me to be a politician. A little bit like I got there and, what it is to do politics. And because I needed help, I needed evidence, I became linked with WHO Health in Europe. And they put me in advocacy, and sometimes I just didn't know what I was supposed to do there, but I was there. And I realized there's something really common in all the places. It's the value. And one thing that we should never lose sight of is the value. And when Natasha is saying we're losing words, and we saw that in Astana, in the UHC New Declaration, we're less and less powerful in what we do. So I think if we want strong public health diplomacy, we need to have strong public health, we need to have strong advocacy, strong values, and strong representation. Because you saw on the slide of Ashish that public health workers are from everywhere. How do they feel a shared identity? So as UFA, we go for 3 commitments, because I really said, and I said to Josep, and I said to all of you, I don't want to make a statement for the sake of making a statement. I want to make something that we do something after, and we have milestones for you, hopefully together. And I don't know, Dorley, did someone of our team come and ask you for a platform in Gastein? No, we'll come back to you. We'd like to use a platform so we meet next year and say what happened. So as you found...
Can't commit, Dorley, no.
Sorry, I thought we were 3 of us looking forward to talk to you. So the bad diplomacy there. As UFA, we commit to 3 things. First, convene a city and region roundtable in the next European Public Health Week, 4th to the 9th of May 2026 in Brussels, possibly with some of the friends here who work with us in Brussels. Second, we are implementing the UFA Academy, and it's a plan for, I don't know where it's Robert Ortok, or Pokemon Sing, UFA and ASPHERE together, the UFA Sphere project, that we need to train people in the schools, but also outside of the school, because public health people are never always only come from, traditional education. You've been doing lots of many things. So we commit to develop public health ambassadors for continuous professional development in the UFA Academy in the next years, because it's not something that's happening. Last but not least, we commit to support, organize a platform to unite, unionize, and represent public health workers, because we're not represented in Brussels. We don't have unions. Healthcare workers do, not public health. So please stand up for public health. And if you want stickers, Unite for Public Health. Go around.
Wow.
You have one. And let's unionize, because that's how you get power. And then we can block Brussels with ambulances instead of tractors and get our laws and our money back. Thank you.
Brilliant. Is that diplomacy, or I'll bring back to you in a second. Is that diplomacy or is that advocacy? I leave it. You'll come back. You'll have plenty of opportunities. I leave a question in there. But I want to say very quickly, I already got number 5, shared public health diplomacy curriculum. Number 7, public health ambassadors. Number 8, citizen region roundtables. Now people start paying attention there. And number 11, unions. So I want more numbers and I want more pleas for these areas. Ayman, you wanted to add something?
Yeah, no, in all fairness, I just wanted to mention something that was mentioned yesterday, because that was my responsibility to say what was talked about yesterday, that public health diplomacy does not necessarily need to be global, that the local function in public health diplomacy needs to be very important. The work that Ashish does in Memphis, Tennessee is local public health diplomacy. That's all I wanted to add.
Perfect. It is true. It's not just a global level, but also a local level, as we learned very much when Charlotte was a mayor, when she worked as well as in healthy cities. Claudia, I'm particularly happy to have you here from GOG, from the National Public Health Institute here. You've done many, many things, but one I'm particularly excited about your work, and I don't know why you're going to talk about that, but anyway, I'm going to say it anyway, is all your work about knowledge brokering, about being in evidence to practice, doing it yourself, but also thinking about that, developing strategies, pushing this world. So, welcome.
Thank you so much. Well, listening to everything was said here in the last days, I think we are quite aware of the, importance of health diplomacy, but I'm not totally sure if everybody else is aware about it, I think we need to remember that health diplomacy and think of, the antivirals we have now in Africa or the recent pandemic treaty has played a crucial role in improving health equity in the whole world, hasn't it? And we made people stay healthier, but it's not known that we have an important part in it. So I think this is something we need to change. And I also think that a lot of this, all these negotiations, I also considered them to be a bit on technical level, and made it for sure that once there was an agreement, this went all the way. But I realized when I heard about Mr. Kennedy, more or less, I don't know what's a good way, jumping into a meeting unannounced, changing everything. I was really wondering, is there no protocol for this? Can he do it? And why did everybody stay seated? It's up to us to counteract if we don't like some habits or activities, okay? So I also understand that I have to say also some of these concrete actions I learned, and I will follow what you, Ashish, said on the local level. I'm actually a big fan of that because we keep reminded all the time that health is national responsibility, especially in Europe. So, and this starts on the local and regional level. And in our institution, we do a lot, so it's for this point to convene, I have to read it, to convene citizen region roundtables. This is exactly what we are doing, for instance, in GÖG for a long time. We organize seminars with the majors of small cities, explaining to them why healthy food for their children in their kindergartens is important and a lot of other things. And this is really working well. And not everybody, remembers after 1 year or two, but still some of them listen and we see some change. So this is one concrete action point I think perhaps all of us can do. And what else we can offer, you have to say that I was recently elected to be the chair of the JANFI Regional Network Europe. JANFI is the International Association of the Public Health Institutions, and I think we have some topics for these priority areas. There is a very good working climate change committee. It will meet soon in Lyon in November. And I was tasked this summer in the Maputo annual meeting to talk about heat. And I was thinking, oh my goodness, what shall Austria tell other countries, the whole world, about heat problems? And I was so amazed.
Until this summer.
No, it was amazed. We had a tremendous rise also in Austria about it, how we handle it. It's the same problems, but on different levels. We have a heat resilience plan, for instance, and a lot of countries were really interested and addressed us afterwards, how they can learn from us. How we made it that it's stick to it, for instance. So this is something we can all contribute, I think.
Excellent. Thank you very much. Ashish and Ramune, I will not be repeating all this, please, but you're taking notes because then you're coming back and you're going to hold accountable everybody. And Dorley has implicitly already agreed on number 10 to have us every year here to see how far we got on this area. Very diplomatically. Claudia, one important point about climate. One of the points there is, what are the areas we should be working on? Is it climate, is migration, is vaccination? What areas we need the effort of public health diplomacy? These are areas, Gaza, yeah, you are. Maybe public health diplomacy in Gaza. How does that sound, Monica? From WHO headquarters, a complex thing to do, right? But, you know, so these are the kinds of things we are talking about. These are the kinds of things we want to do public health diplomacy labs. These are the kinds of things we want to see what's the role of public health. But let me start with the fishbowl and call all these other fish in here. I have to say, I'm cheating a tiny bit because there was already offers, so I have 3 offers or supply-induced offers, demand offers, like the one of Alexander Zakula from the senior health expert and professor, University of Zagreb. Alexander, I will give you only 2 minutes, those who come in and out, but we want you here. Alexander, I'm not sure whether you are an advocate and a diplomat, but you're someone with a powerful voice, not only real voice, but powerful voice in public health. So I'm very happy you are the first fish in that bowl.
You said about the key link between the diplomacy and public health. Diplomacy could exist only if you have powerful people and powerful institutions. And this crisis in public health is directly linked to the crisis of public health diplomacy. And the second important information, or I can say finding, is that the crisis in public health lasts over the 15 years. It started in 2008 with the economic crisis, because at that time we didn't recognize our challenges and our opportunities in new technologies. So our team in our school developed a new pilot program, and we implement a new approach, and we replace our role of experts and the teachers with our role of change agents and the leaders. So this is the paradigm shift we need to implement. Otherwise, we'll have bigger and bigger problem in public health.
So are you training leaders, political leaders in other sectors in the school?
Yeah. We need to train not only our people in public health, but other people outside the public health.
And that's what the school is doing?
Yeah. Our team, we have a pilot program inside our school. We try to empower our customers, decision makers, politicians, institutions.
And you get to take up? Do they join? Do they come?
They come. Why? Because if you are really change agent, they need you. If you are an expert, they don't like you. So this is serious shift. You have to be change agent, responsible change agent. Then they will call you, even if they don't like you, they will call you. If you're expert, they will hate you, they don't like you, and they will avoid you. So power is in change.
Beautiful. Nice. That's the kinds of examples we need. Can I have more of those, please? Let me invite the young Steiner today, they had a great workshop, I heard, right, Ayman, you were there? So I'd like to have Daniela Pietes, please. They had a great workshop with the young Steiners. At the end of the day, if we need to learn about diplomacy, we need to learn from the new generations using better communication, better ways to communicate, far better than some of our generation did. Daniela, what you got out of it?
So some of the main points that we discussed with regards to public health diplomacy and addressing global health challenges were bottom-up approaches. Even I heard that some here did not fully agree with it. But to start local before going global, the need for communication skills, engagement with citizens to have local and community leadership in place. But also tailored communication for audience diversity, effective and understandable language use of words, and then especially simplifying technical terms so that research outcomes can be in an effective way translated to the citizens and communities, as well as cross-sector and multidisciplinary approach towards public health in general. And we also discussed how can youth play a role in advancing public health diplomacy, and there the main point was actually social media. maybe not surprising. And so the use of influencers, young health advocates and ambassadors on social media to raise awareness and spread evidence and knowledge among our peers, and in that way building networks. And while we were discussing this, we actually were realizing that we were already health ambassadors ourselves and that we actually just have to voice ourselves more and also get opportunities for that.
Brilliant. Communication, simple language. That's what the populists did very well, and we need to learn to use the same tools as they did. Why is it that we're so lousy, apart from Martin McKee and few others, at communicating and using social media? Why is it, Martin? Can you tell us, maybe later reflect on that? Because that's probably what we need to have in our training courses. I'll ask you to leave the hot seat now, sorry about that. And I'm going to volunteer Stefan. He doesn't want to, but he's a man that in the Ministry of Health, I've seen him in various roles in his life. He's a true diplomat for me because he manages to get through ways, some strategies very impressively. What is your reflection on that? Sorry by taking you by surprise.
Well, no, it's not such as a surprise, but I needed to help my daughter with her math homework because I wasn't there the entire week. So I had to calculate with her how long it takes for, well, I will not go into details. It's getting complicated now. She's too old for that. So if we talk about public health diplomacy and what works and what doesn't work, I think that's there are some simple elements, and it's wonderful if that is provided and supported, obviously, by the evidence and research that is discussed here. And for me, Gastein is one of the areas where you see then how actually many of the elements of public health diplomacy work, but then in the inner circle. But also there already, it is so important because I saw so many activities where actually between different sectors, between different countries, health diplomacy took place in the sessions, in the breaks, right? And the question for me is really then, and maybe this is also the challenge for Gastein and all our events, likewise events, how do we get then to the next circle around, right? And I guess there it's really the important aspect that we realize the different languages and how to communicate on those languages, and also to make sure that actually our work is of relevance. So this feedback mechanism. And I just heard, and I couldn't agree more with also the question, if we want to get reforms done, we need to be inclusive, right? And this is one of the discussions we see in many of the countries about hospitals, and this is also particularly a topic here. And we see it is always difficult to transform hospitals, to close hospitals. I think some colleague told that this was maybe the most difficult part, the transformation of a hospital, and there were many difficult parts on her job duties. But we cannot do that without proper health diplomacy in a way towards the public, and to involve the public, and really trying then also to win the public that it's not only a cost issue, but it's really for quality, it's for areas of also the health workforce that we do run into difficulties. So it's a lot about language. I think we can learn from health diplomacy, hopefully, also on different other areas, be it in WHO on the European level, wherever, and bring that together with the very local and community health diplomacy to make sure that we actually get things done, because it's not about writing and concepts, but it's about the implementation in the end, right?
Perfect. So we're getting points about the kind of training we need, the kind of communication, the kind of language that is very helpful. Okay, I'm going to ask you to leave the fishbowl, if that's okay, because, have many people want to be there. I'm going to start here. Join me there, quickly.
Right.
Yeah. And then I'll start distributing.
Yeah, hi, thank you. Alison Mawson from EuroHealthNet. Thanks, this is very interesting. I wanted to talk, 2 years ago was the last time I had the pleasure of being here, and we were here because we had a session on vaccine hesitancy. And during that session, we talked about 2 particular tools that we're using, health promotion approach to reach underserved communities, and then this very cool tool called empathetic reputational interviewing, which is a sort of motivational interviewing. And I think a lot of the public health hesitancy that we face today has its roots in vaccine hesitancy, a lot of concerns around the COVID vaccine, our friend RFK Jr. So I think there's a lot that we can learn from what kinds of efforts we've been doing around vaccine hesitancy. And so specifically this empathetic reputational interview tool is something that was developed by the University of Bristol, part of a project called JitsuVax. And they did this terrifyingly enormous literature review. You asked for pragmatic things. That's why I'm talking about this. What can we do on Monday morning, right? So they did this huge literature review, and they came up with 14 attitudinal roots of vaccine hesitancy. And then they developed a toolbox to help health professionals to counter each one of those different attitudinal roots. So if someone's coming and they're saying, oh, I don't know, it's against my religion. Oh, I don't know, I'm afraid. You know, you're getting the specific tools to have the conversations that respond empathetically to what that person's concerns are. So Caroline, our dear director at EuroHealthNet, had a presentation in the Sant Committee last Thursday. And I don't want to say got attacked, but there was quite a strong response from a colleague from AFD in one of the MEPs. She gave a masterclass in pretty much every stereotype of why public health is evil, right? We're all going to become clients of the public health state. This isn't a medical science, etc. Could we not take, this speech from this MEP, various things we've heard from our dear friends
and we learn how to respond
and
to
are
that.
we doing attitudinal roots to understand these things? Right, what is our response then to this? How do we do this?
That's
and those
great
are
training materials,
So those can be one-to-one conversations with people, because a lot of diplomacy is one-to-one. I think we're here talking very high level, what's happening in Belarus. That's not unimportant, but at the end of the day, it's those one-to-one conversations to come to the, and this is the last thing, promise, to come to the other thing. So that was part of what we presented 2 years ago, was this ERI tool. The other thing was these great health promoter interventions that we're doing in communities across Europe as part of a project called River EU. And I want to come to health promotion, because I think, we had a big debate in the lunch. Is it diplomacy? Is it advocacy? Also, is it promotion? We talk about going to local communities, regional, but a lot of that is already what we do when we do health promotion, right? And so let's not forget about all the lessons we can bring from health promotion. And
so I guess EuroHealth, Caroline, is joining us. I have the pharmaceutical industry, don't worry. Wait a second. I know. Thank you very much. I'll ask you to leave. And one of the problems with the fishbowls is that one doesn't see anybody, and I forgot one of the greatest diplomats I know.
Sit in the
Vesna.
fishbowl. Oh, sorry. Sorry, there's another.
Oh, sorry. No, come on.
Let me be in charge. Let me be in charge. Let me be in charge a bit. Come on.
I was asked by your leader here,
I'll ask you to react in a minute, okay?
It works.
So let me have a few more.
Okay. So I think we need some clarity here. I'm a public health professional. I worked for the government for 30 years. I've done a lot, and most of it was done because I'm a doer. I did it. I can prove it. Some of you know. I've done things. So I'm not just talking, I've done things in tobacco control, alcohol policy, whatever. And the last thing I did is I brought social participation to New York. And I had a Kenyan president there and my president speaking of health and social participation, which is including people in decisions. So what are we speaking here of? It's maybe not that important if we call it diplomacy or we call it health promotion or advocacy. Advocacy is a little bit more than you said, because it's also, using the tools to ensure that those that decide hear us. And it's not always us who are the ones. I use the youth very often for me to be heard as a public health professional. So when I'm doing public health, this is what I'm doing. I'm public health professional. I use diplomacy. I use evidence. I use advocacy. I use even communication in many different ways. I also use health economics. And in all this, I'm not really good, I have to tell you. So what I do to be really good, I get people on board that are better than me. I get health economists who support me, give me the numbers so that I get it right. I have researchers on my side to provide the data. For example, you say local, in municipality. You know what engaged our mayors in Slovenia? The data, because we provided data how they are doing in their local community, municipality. And when they saw the data, they started to listen, because if you give national data, it doesn't refer to them. Is this diplomacy, advocacy? I don't care. I use everything available to have it done. And so whatever we discuss today here is fine. We are public health professionals. We should use everything, not always doing it ourselves. Maybe we should use diplomats, because I had to deal a lot with diplomacy. It's super difficult because you have to tell them the concept of social participation. Do you know how difficult it was for them to understand why in New York, Slovenian diplomacy should have a big event with the president on something social participation? What is this? It's not peace and war. This is what we want, you know, diplomacy. But you need to convince them by explaining, getting diplomats on your side, because they are the ones that brought me to New York. It was not me. I'm just a poor public health person here.
All right. You are anything but a public health person, and I wish we had more time from Vesna, because there are many examples, like with cannabis, with tobacco, with alcohol, many areas where she used, I'm almost about to tell some of your tricks. You use your diplomatic role as part of the ministry and their unionizing role with civil society to echo that, like on your right. So let's continue, please.
All right.
Short and sharp, please. And then
this one
you already got the microphone.
Yeah, yeah. All right. So I'm Boris Azais. I work for MSD, a pharmaceutical company with a long history and contributions to public health and health systems. I'm not going to talk on behalf of my company. I'm going to talk as a European citizen and a French also, And I've been an observer to the public health community. I don't have a MPH. Everything I know about public health system policy, I learned it from, the best, Joseph, Martin, Matthias, Dimi, and so forth. So I've learned that way, and I'm bringing the standpoint of somebody not just from the private sector, but like everybody's from the private sector, or most people are from the private sector. So I will be a bit, maybe provocative, because I tend to do that, but I don't mean it in a bad way. No, it's just a major defect. So two illusions that I noted very early on in public health. First, there is the belief, the religious fervor for evidence, which, of course you need evidence. But you're probably familiar with the study that shows that data shows that showing data to people doesn't work. Data shows that showing data to people doesn't work.
Unless it's diplomats.
First,
unless you show it to the diplomats. Unless you give it to the diplomats.
Learn from that. I don't know. Second illusion, trustworthiness. By default, you have the values, the data, so you're trustworthy. Richard Horton taught me that public health is one of the few public areas where you have a license to lie, for good reasons. Okay? For good reasons. There are cases and situations where
put that in the list?
You cannot tell the truth. If you tell the truth live, people are going to die. Okay, so this license for to lie, you need to really think about it and look at it, because COVID taught everybody some very, very deep lessons about that. And Anthony Fauci has probably a target on his back in the US, because there are some a few things happened bad with COVID early on. The mask. Don't get me started.
I have to stop you here, because it's taking more than 1 minute.
Final thing, behavior change.
I know.
Ask yourself how the large food companies, tobacco, whatever, how these companies are superbly adept at behavior change. I mean, really selling products that might not be needed.
We need learn a lot.
from it. Pekka Puska. Who remembers Pekka Puska? Okay? Minister of Finland.
I have lots of people want to join.
Nudge. Put the salad bar first.
Nudging is not enough. Nudging is not enough.
Look at the curves.
We need legislation.
Cardiovascular
Ayman
disease
is
in
removing himself into his...
Pekka Puska, yes.
Pekka Puska, yes. Michele, you want to start joining here? But we have Ayman reacting
obviously,
because...
you've seen something here which is very true, that public health professionals are very excited about their role in changing the world. And as a public health diplomat, there is a sacrifice that we need to make, which is approaching issues with equipoise and neutrality. That is not very easy for us. We've not been trained to be neutral, and we consider it a cop-out. But I will give you one example. First of all, public health diplomacy is related to confluence. I'll take 1 minute. I'll give you an example. In the United States, climate change has caused, like in many other places, extreme heat during the summer. This has affected construction workers in a very serious way. I'm very pro-labor, and labor unions have created conditions under which workers will not go outside buildings at a certain temperature because it's dangerous for their health. Now, mind you, a very significant number of construction workers are undocumented, or what we call immigrants without papers. Do you think they belong to the unions? Do you think that the unions are reaching out to them? Most of the... Are these materials in Spanish? No. So, inevitably, immigrants without papers in the United States need a form of diplomacy in order to assist them. And raising voices is not in their interest at all. Raising visibility is counterproductive. Working quietly as a diplomat, as Martin said, in camera, is the way to solve such a problem. I just want to emphasize, there are situations that don't lend themselves to loud voices at all.
Yeah, you may end up undermining them. But what I want to hear, that's fundamental, and I want to hear more about, please, I want to fill that list, please. You know, we have license to lie, we have unions. No, seriously, I want more things in there, more things in there. You are the European Regions Health Network. Are you going to play something?
Well, I think actually I'm gonna maybe double down on what Charlotte said before on the cities and regions roundtable. It's not an extra one, but I think I'm doubling down.
We'll put a tick in there. Yeah.
Let's put a tick in there. Not only what we can do as a network of regional and local health authorities, also building on the fact that we do have regions here in Gastein this year more than ever. We have Andalusia, Central Denmark, so it's really good. But let's also connect with the other networks that are already doing that. WHO Regions for Health Network, Healthy Cities, the Committee of the Regions, the Covenant of Mayors. We have a lot of allies that we can tap in and start to have a really big diplomatic effort on that. Maybe not only in Europe. Let's get the examples of what's happening abroad.
Perfect, perfect. Thank you very much. That's a clear plea. We need to support these constituencies. Please.
So my name is Chelsea. I don't know many of you here because I'm not from
That's
Europe.
okay, don't worry. It's good. It's a good thing.
Thank you. So I am a public health professional. I'm not affiliated with any organization, agency right now. And I made that choice on purpose because I don't feel the pull to be affiliated with any organization, and there's a reason for this. So I speak to you today just as a human being, and this is my context. I am Chinese, as you can probably see. I don't see a lot of Chinese faces in here, but I have lived in Canada for the past 20 years, so I'm also a Canadian citizen. And I'm so glad, Natasha, you mentioned about the pandemic, how it has perpetuated the broken public health diplomacy that we see today. Because I think it started probably even before the pandemic. I was working for a very reputable hospital as a project manager on a COVID-19 research project with the long-term care sector in Canada, one of the biggest ones in the country. I may tear up, but apologize ahead of time.
No worries.
What I've witnessed, I'm not proud to be a part of it, to be honest. And public health is very political. And for someone who works in the public health workforce, your well-being is not a priority anymore when you try to cater to the needs of so many who suffer from very poor governmental decisions that keeps changing and keeps going back and forth. And I think that's probably the case in the United States as well. It was really heartbreaking to be a part of it. But then the other part of my experience is being a Chinese. Being a Chinese who's no longer a citizen, I have been separated from my family for 3 years because of the travel restrictions and quarantine measures in mainland China. So I haven't seen my father for 3 years, and I wasn't able to make it to my grandfather's funeral. And I made a conscious decision to leave the Canadian healthcare workforce so that I can actually move to a country that I actually no longer identify with, to be closer to my family. And that was really, really difficult. And I think public health diplomacy is broken between the West and the East. And I was hearing so many stories of a lot of overseas Asians, not just Chinese, being attacked physically, verbally, emotionally, through the portrayals of China in the Western media. And I think public health diplomacy, or any kind of diplomacy, has to move beyond that, because
Indeed.
there is no other way
Indeed.
that we can solve the brokenness.
Thank you for this testimonial. You brought us to a very painful reality that actually helps us to center very much this debate. And she's not affiliated to any of your organizations. So all of us, leading organizations, should be thinking about that. You want to join? But before, I'm going to ask Valérie Dubois, who is actually in charge of taking people from online. I'd like to select quickly those aspects that have contributions to suggestions to strengthening public health diplomacy activities. Please, Valérie.
Hello, everyone. So as mentioned, I've been monitoring the questions and comments online. We have actually more questions than comments, so I'll maybe shoot some questions, if that's okay.
I'm not sure I'm going to address them, but
okay.
Put them on the table. It's important to hear them.
There has been discussion about the flood of misinformation and how we can tackle it. And also about challenges to public health diplomacy, about the current state in the world, how it can realistically deliver to the fractured world that has been mentioned before by other speakers, and also forward-looking, how we can prepare for predicted challenges that we are not facing yet, but that are coming, to be prepared instead of only reacting to what is happening.
That's perfect, and gives us even more ammunition. I'd like you to consider, all of you that are going to go join the Fishbowl, if you want to start sitting there, those who are on the waiting list there, to actually try to address those questions. Charlotte, I want to bring you back because you disappeared. And Claudia, you want to either tackle the question or make your point?
Thank you. No, I was, for once, really going ahead with Boris, saying that I was also trained to provide evidence, you know, as a health economist. And then we provided more and more evidence if people didn't understand it. And then we were trained to put it in a more nicer and way. And everything must be on a one-pager, otherwise it's not read and accepted. But I get this feeling that people no longer care of evidence. And perhaps it is also because they're tired of the misinformation everywhere. But I think what was said about being on the emotional level of people. This is exactly what we have to do as public health experts if we want to carry through with our message. Then, and to convince, as Vesna said, we have to convince the diplomats first, so it can be tackled in, important gremia and fora. But we need to establish trust with them. That's the first thing, and we need to tackle their emotions and not only facts and figures. And this is something we did wrong, I think.
But something I learned from you, because we all disagree with Boris today, is not the evidence, it's the way we communicate that evidence, the emotion in that evidence, the ability to tune with the tacit knowledge of our policymakers, our diplomats. But it's not the evidence, it's the way, because you taught me that for many years.
Well, it's also the fact of coming back to your mistakes.
You ran out of your minute. Can anyone remove that? This is not the democracy.
I make the seat free first.
You sure? Okay. You want to?
Yeah, and speaking of the respect for others, in this case, of course, it's not only about the way or the how, but also about the where and the with who. And in this particular context, stop thinking of the influencers as the others. You are the influencers as well. So Monday, open up a social media account in a social media that you currently do not have and start using it. Start using it. And instead of treating our communication like an Olympic discipline that only a few can compete in, this is something that is a mass exercise. Go back, open up a social media account in a social media that you're currently not using, start using it. Recruit 10 of your colleagues and do the same. This is something that we have to move beyond so that we actually are able to, by numbers and by skills, are able to use that. Andrzej Kulaj, the new MEP, of course, we cannot, everyone, have a TikTok account with 370,000 followers, but we can stop disregarding TikTok as a medium that we simply do not want to use because it's beneath us. Essentially,
beautiful.
So the existing academic publishing is a social media. You create posts, you want likes, you want retweets. Well, we call them something else, but it is the same, the mechanics of it. But that leads to, of course, that currently the policy in most universities and academia is that if you do social media, that might actually harm your interest in getting your professorship.
That's changing. That's changing.
It
if you
is.
work with people like Charlotte Martin
but it
McKee,
is
many of these
definitely
people
not
here
changed yet.
changing.
So remember that you're an
Beautiful.
influencer. And
Thank you.
Open up an account Monday.
Thank you very much. How many people here use TikTok? Can I see your hands? How many people? 1, 2, 3, 4? Okay, next year I'm going to look at you, and I want everyone, including me, because I don't use TikTok, raising your hands, okay?
Or
Even
another
when
one.
But TikTok is going to fall in which hands now? You followed.
Yeah, but
one of the cronies of Trump.
It doesn't have to be that one. There are so many others.
So
Just
next
do it.
year, put that in the objective,
Yeah.
all using TikTok. Thank you very much for this reminder.
Yeah.
Please.
We should buy TikTok together.
Okay. Dorley, you have lots of money. Where's Dorley? He's gone? No? Lots of money. Let's buy from Gastein TikTok.
Hi, everyone. Sean Palmer. I work for a nonprofit based in the Netherlands. First-time guest Steiner, young guest Steiner. And a few things I wanted to raise, and talking about needing new tools in the toolbox, and the current situation we find ourselves in, and the need to connect with people's emotions, empathy. And one thing that's really missing, I think, is the passion as well that we communicate in. You mentioned we're not taught about the position of neutrality, but I think we overwhelmingly take neutral positions in our emotion when we're engaging in public health diplomacy, advocacy, whatever we may call it. But there's no neutrality here. We're talking about justice for people, health justice. We're talking about meeting people's fundamental needs to be the best people and most productive people they can be. And that isn't a position of, we can't be neutral there. And we need to bring that passion in our advocacy, in our public communication, in our lectures in public health schools, in our communication online and whatnot. And I'd be remiss to not mention that one thing I feel like hasn't been flagged much this week is that there's a genocide going on in Gaza, and that is so linked to Europe. We're funding it, we're complicit in it. And if we can't draw a red line, if our leaders can't stand up on a stage and call a spade, that Israel is committing a genocide, then what is our red line? Where do we find ourselves? Public trust is plummeting, and this is a huge part of it, that atrocities take place in our name, with our money, and we can't draw that red line, and it's so critical that moving forward, we bring that passion. Yes, we use the data, but there's red lines we can't cross, and we need to stand up for one another's justice everywhere, and not take a position of neutrality in our emotion, let alone in terms of, how we communicate it.
Thank you. The question is, Ashish, how many of our public health people actually have emotional intelligence? Should we select them better, perhaps, before we train them? Should we train them to have this emotional capacity? I'm not making fun. I really believe in what you're saying. If you don't believe in the values are fundamental, as Charlotte will remind us on this. Thank you very much indeed. Thank you. Please.
I just wanted to very quickly reflect on what was, I think, still hanging in the air on this having the permission to lie as public health officials, which is something that really doesn't really go well with me. I'm a pharmacist by education, and I never wanted to go into pharma because I wanted to have a higher moral ground of being a public health expert and not having or being in a position where I would have to lie. So I think this is not something that I would be willing to accept. And also I think that we are not in a position where we can take the stand where we can lie because people, once they first see, or the industry, once they see that we're lying, we're losing their trust. Anyways, we're already on a shaking ground. So just wanted to make this point.
Thank you.
Beautiful. It's becoming testimonials of many of you that try to make a difference and the complexities in doing that. And I think that's touching many of us. It's touching me, definitely. Actually, I should ask you to introduce yourselves. I know many of you, therefore I assume that we all know each other. So you haven't introduced yourself, have you?
Yes, sorry. Urška Klavec. I'm from the National Institute of Public Health in Slovenia and also as a volunteer in youth health organization.
Thank you. Please.
Thank you. Well, I will introduce myself. My name is Jane. I'm from Ireland, but I work for the Luxembourg Health Directorate, and it's my first time here in Gastein, and I'm absolutely delighted to be here and have had a great week. So the point that I would like to make, I'm also a pharmacist, by the way. So I'm relatively new to public health in the strict sense. However, as a healthcare professional, I've been effectively working for public health my entire career. And that's a point I want to make. All healthcare professionals, even if they're not public health specialists, are working in the interest of public health. So I think that education in diplomacy and all those soft skills needs to be in every undergrad program for medicine, for pharmacy, for nursing, for everything. And in fact, I just learned this week that Trinity College in Dublin, the medical school, have just introduced a program for medical diplomacy in their undergrad. So I think that's extremely important.
Really good. Thank you.
And the other point that I want to make, and this relates to a discussion I had with the lovely Natalie this morning. Where are you, Natalie? There you are. And it relates to resilience of healthcare professionals, which is a little bit linked to the previous discussion, but I'd still like to make it. Natalie was saying this morning that in Kiev, where she lives, that the doctors, that in the hospitals, the doctors and the healthcare staff, they are the only ones left with the patients when everybody else has gone to they've gone to bed down in the bunkers. Everything is quiet. Everything is they're all safe down there, and only the healthcare professionals and doctors are left with the patients. So they are extremely brave people. Medical professionals are so brave. They're the last ones left with the people who can't move, and that strength can be harnessed for this fight that's ahead, right? So the strength is there. It just needs to be recognized that the strength of the doctors in Ukraine and other war zones, and in Gaza, of course, yes.
That's a very...
Yeah. So thank you.
Thank you very much. we are all public health, but not only the health professionals, many other professionals. And one thing that both schools of public health are representing here has been to broaden public health to many other professions and consider them part of the group. Thank you very much indeed. The last point, perhaps, unless there's another one. You want to come in? Okay, come in. Last one, because I want then Ashish and Ramone to conclude us with the danger that Martin McKee will leave the room on time. And Charlotte. Sorry, Charlotte, I apologize. Please. Actually, Monica was an advocate, and now she's a diplomat in WHO. How do you manage?
So I'm always terrified in terms of how you're going to introduce me, Josep. So I'm going to be, risk. I'm a boring civil servant. So this is you're going to get a very boring answer, but this is a very exciting conversation. And you may remember, but my background is international peace and security. I was trained as a diplomat first and then came into public health second. So when I hear these discussions, I hear three things, and looking at, thinking about what you've asked us to do. The first is the interpersonal diplomacy that we've been talking about and the training that you have there. The second, we're talking about public diplomacy as well, the conversations that we're having with our communities, our public, and so on. And this is, my training was back the value of the BBC World Service and Radio Free Europe and what role that played as a diplomatic tool. So the conversation about buying TikTok is not such a far-fetched ones. We know in public diplomacy that those that control the means of communication control the message. So that's very important for us at public health because we don't have that as part of our toolbox, going back to what Natasha said. And a third one, and here I really am a very boring civil servant. So I was taught that diplomacy is a tool of statecraft. It is an instrument of foreign policy, and actually the real diplomacy happens with the important people that we have to persuade to take us to New York. And that's very important in public health terms because I've just watched my friends and colleagues in Geneva carry the pandemic treaty for years. That was hardcore diplomacy and a huge, painful success for us as a community. And we have these instruments, these diplomatic tools that we use, we don't use, but they are a very important part of our discourse. So for me, the three dimensions here, the interpersonal, the public diplomacy, but then also the tool of statecraft, and I include city diplomacy as I would, of course, coming from Healthy Cities, as part of that, and seeing our action points within those different groupings I see as a way that can help us.
That's very helpful. Thank you very much, Monica.
Hi. My name is Jonas Huber. I work for the Austrian National Public Health Institute. However, I would like to not speak in the name of it. I would just like to speak as a young citizen, and I would like to add on the voices of the young people here before, and on the discrepancy between public health between the East and the West. But I think I would like to add on that it's not just between the East and the West, it's also between the North and the South. And I think we need to reflect on the pandemic and the big debate that happened there on vaccinations and the distribution and the copyright of vaccinations. And when we're speaking about trust, I think we need to lead by example. And also when we're speaking about solidarity, we need to lead by example, and we can't expect young people to be caught by social media when the big lines are not aligning with it and we're not living solidarity. Yeah, that's what I would like to add.
That's perfect, thank you. Ashish, when you conclude, I'd like to remind us of the kinds of initiatives that you are doing with the South, actually. So, Charlotte.
Thank you. So one of the things about diplomacy is having a seat at the table. Whether the table is hidden or not, it's having a seat at the table. Why did I leave? Because if we want young people to have the voice, it's not just having them sometime and leaving. It's what we had with women, being.
I agree.
So we have to let the seat at the table for young people. About Palestine, for instance, we're bringing a session in EPH conference about Palestine, about our responsibility. And because it's about emotion, we're bringing poets and singers to have poetry for Palestine, because we need to grieve together what we are facing. And I think in this case, evidence is not enough. We need to feel it, because we have to acknowledge together what's happening, and we need to give a voice to other people. I'm not an artist, but I can give the seat at the table for the artist. Last but not least, who gives you legitimacy? I'm not WHO, I don't have a blue or red passport, but we have to be the one empowering other health ambassadors. And that's really the point. How do we say, and as Jungersteiner, you say, now we feel our health ambassadors, but there are so many other people that don't know they could do that, and they're health ambassador without knowing it. So how do we empower them? And the only thing is unity. So yes, social media, but social media together, because alone you're not going to fight the Russian farm boats. But if we do together, and if we are the public health boats, then we might succeed.
Thank you. I will ask the protagonists to wrap us up. Very good point, Charlotte, about the fishbowl and how we conducted it. And I realize that Ayman left and some people have. And it's not symbolic, it's real. So come back, please. I feel badly about one thing. There are many, many other fish here. I'm looking at my good friend, Vytenis Andriukaitis. Perhaps he's the only commissioner I will ever meet, that was an advocate, as well as a diplomat, as well as a civil service, and he managed to survive and do the three things very, very well. I would have hoped to have you here. I was trying to encourage you, but today you decided to stay there. Many, many all of you, I could pay homage to many of you that I know what you're doing. I've seen you on the road, make a difference. I'm sorry I didn't run it well enough to have all of you here, but thank you very much. Now I'd like you to conclude us. What have we learned?
Yeah, thank you so very much. First of all, I just want to thank you all. I think the passion, the commitment, the energy, the positivity, the opportunity, I think it reflects that no matter where we are coming from, who we are, what sectors we belong to, but we have one mission, and that is good health and well-being for all. So I think that's one thing which I've really learned, inspired myself, and actually, to be honest, rather than coming and talking about public health diplomacy, actually you have helped us define public health diplomacy today here. Right. I think that's a very important element. And I can tell you I'm getting goosebumps out over here. And having emotions is a good thing. I think the two things which I've learned from here is human connectedness. We're missing the human connectedness. It's become too transactional. So I think public health diplomacy should have human connectedness as a pillar for it. Second, we as public health and healthcare professionals are not the only people who are going to talk about public health. We need a lot of surrogates. We need a lot of alliances, a lot of coalitions. Public health is for all and for everyone. It has no boundaries. Knowledge has no limitations. It is going to be out over there. I'm sorry, but I just feeling a little bit overwhelmed right now, just with the kind of conversation. And I think the whole purpose of us just sitting around the table and having that dialogue, I think it has achieved its own goals, its mission, and just tells us one thing. Together we can, and together we will. That's where I would like to conclude.